Remember when our lives had no restrictions and we were allowed to do these types of activities freely, such as shopping, carpooling, hanging out with your friends or family, giving a handshake, going out to the cinema, shopping, traveling and so on. Then, COVID-19 came and turned our lives upside down. From going out and having fun, it turned into us having to quarantine, social distancing, wear masks and hand sanitizers as a precaution. What is COVID-19? The 2019 CoV respiratory disease, or worldwide known as the coronavirus, started in Wuhan, China. Coronaviruses, CoV, are a large family of viruses that cause illness ranging from the common cold to more severe diseases. The virus began in animals which hopped to humans. Researchers have said that this virus originated in bats. The virus is spread globally in almost 28 countries, mostly major in Southeast Asia. Some countries have banned flights from China as they do not want to take risks of increasing the rate of spreadness of the virus. How did Malaysia deal with the pandemic? The first wave of COVID-19 epidemic took place on the 24th of January, which had a very small number of cases. Then the second wave hit in late February, but however, this time the cases grew rapidly. In only the first 3 weeks, the government of Malaysia had prepared several precautions to prevent further transmission of this disease. The first strategy made was the Movement Control Order, which is famously known as MCO. This movement is a strict nationwide order to limit movement and border travel. Also, limiting physical contact and having proactive surveillance among individuals with influenza-like illness and severe acute respiratory infection. The national MCO was later replaced by CMCO and eventually by RMCO. As changes were made, tighter regulations were implemented, such as restriction on the number of worshippers to the size of the buildings, e.g. the mosque, school is only open for certain year groups. Giving priority to Form 5 students, a limitation of 250 people in public areas or events, and the obligation to put hand sanitizers and temperature scanners in communal places, like malls, restaurants. Here is an illustration of how each movement helped with lessening the cases. It clearly displays the benefits of each movement, and without them, the cases would be higher and the situation in Malaysia would be more horrible. Social media plays a big role during this time as people use it to raise awareness using the hashtag #StayHome, and it is hoped that important messages to stop the spread of COVID-19 can reach all levels of society. All 3 nationwide orders contains different set of rules. First of all, the MCO, Movement Control Order. This strategy is the most severe and controversial since it restricts movement and gatherings nationwide. Travel ban. All educational institutions were required to close. All government and private premises were also closed except those that are involved with supplying essentials. Secondly, the CMCO. Conditional Movement Control Order. A person was allowed to travel for work purposes. The prohibition of religious, cultural and art gatherings, entertainment, leisure and recreational activities and business activities. A person was required to obtain written permission of the police officer in charge of the police station nearest to her house if she needs to travel for any other purposes allowed under the regulations. Lastly, the RMCO, Recovery Movement Control Order. It states that movement and gathering restrictions were less strict, allowing travel from one place to any other place within Malaysia for work purposes, except to and from places which were under the implementation of the Enhanced Movement Control Order. House visits and gatherings were also allowed. Members of the Parliament and state assemblies were allowed to attend parliamentary sittings and state assemblies. Keep in mind, if a person is convicted for breaching any of the regulations, that person will be liable to a fine of not exceeding £1,000 or to imprisonment for a term not exceeding 6 months, or to both. The MCO has affected Malaysia's economy. Most companies have their employees working from home, and some workers have had to stop working. NGOs have been actively providing help to those who are badly affected by this pandemic, such as preparing food, shelter for the homeless. When the cases had risen tremendously, there was a shortage in PPE uniforms which frontliners were obligated to wear. This caused some problems for them because without the right attire, their health was in danger. Therefore, several NGOs and public figures have helped to sew PPE for medical frontliners. The massive and ongoing outbreaks of this virus have become a serious threat with profound consequences for the economy and financial markets as a whole. According to Ambank Group chief economist Anthony Das, direct damage caused by the virus can be seen in the tourism and travel industries, manufacturing, construction, mining, and agriculture. With many workers being laid off and others being placed on unpaid leave, the Prime Minister of Malaysia, Tan Sri Muhyiddin Yassin, has particularly stated that the nation's tourism industry has been crippled, with an estimated loss of $3.37 billion in the first 2 months.
COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. Most common symptoms are fever, dry cough, and tiredness. Less common symptoms are issues and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, and a rash on skin or discoloration of fingers or toes. To date, there are no specific vaccines or medicines for COVID-19. Treatments are under investigation and will be tested through clinical trials. Self-care. If you feel sick, you should rest. Drink plenty of water and eat nutritious food. Stay in a separate room from other family members and use a dedicated bathroom if possible. Clean and disinfect frequently touched surfaces. Everyone should keep a healthy lifestyle at home. Maintain a healthy diet, sleep, stay active, and make social contact with loved ones through the phone or internet. Protect yourself and others around you by knowing the facts and taking appropriate precautions. Follow advice provided by your local health authority. To prevent the spread of COVID-19, you should clean your hands often. Use soap and water or an alcohol-based hand rub. Maintain a safe distance from anyone who is coughing or sneezing. Wear a mask when physical distancing is not possible. Don't touch your eyes, nose, or mouth. Cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Stay home if you feel unwell. If you have a fever, cough, and difficulty breathing, seek medical attention. That's all. Thank you.
Hello, my name is Kanagalakshmi. I'm a nursing sister. I've been working in hospital for 24 years. Based on my experience, challenges faced by frontliners during this pandemic is increase the workload in the frontliners. Furthermore, exposure to the COVID-19 disease is very high. Other than that, the working hours is increased. That's all. Thank you very much.